all sensory experiences involving sight, sound, or touch. It's either auditory, visual, or smell, taste, tactile sensations. I had a patient once who said she felt some kind of strings coming down, and she's telling me, she's like, look, you can't feel them? They're right here. Now, she had a perfect conversation with me. She knew who I was, she remembered who I was, she knew her daughter. She wasn't someone who had super severe, but she was moderate dementia, not severe. And she still saw these little things come down. So what's the first thing you as the caregiver should do if everything was okay, and now all of a sudden mom, like this though, tomorrow, starts seeing strings or starts seeing people? What's the first thing you should do? And it's not validation therapy.
Go to the doctor.
Why?
Get her check, get her appointment.
So this isn't, you guys are on the right track. When someone always has these delusions and hallucinations for 6 months, 12 months, okay, it's not new. But if it's new, I'm gonna be worried. Why? The first thing I wanna think about is a UTI. That's the first thing I'm gonna think about. Now, you're gonna go to the doctor will say, well, do they have any symptoms? Do they have this? Do they have that? And they may say, no, it's just a dementia. Advocate and say, look, it's a $4 test, it's a urine analysis. I really would like for it to be done. Because, and they say, no, I'm telling you, you don't need to get it done. Because if something happens to mom, I don't know what kind of conversation you and I will be having. And there's a pause. Why am I telling you to advocate that way? How many of you guys have heard of value-based medicine? By a show of hands. So here's how value-based medicine works. There's fee-for-service, and there's value-based. Fee-for-service is every time I see Randy, I get $100, for example. Every time. So I'll see him 10 times a year, 20 times a year, it doesn't matter. Value-based, Medicare comes to me and says, look, Randy has hypertension, high cholesterol, I'm making it up, you don't have any of this, you're good. He has all these things, and we know that someone with Randy's profile, his expenses in a year are about $20,000. Now, Dr. Erik, if you can spend $10,000 and not 20, we will let you keep the change. If you spend $25,000, you will have to pay the difference. And some doctors and organizations, they take on that risk. So now if Randy comes to me and he says, I have a back pain, I have a UTI, whose pocket is it really coming out of? My pocket. So what's my incentive now? To do every test in the world? Or to say, now I'm not saying do every test in the world, there has to be a balance. But my incentive is not, and that's how my grandmother, not this grandma, but my grandmother Frida passed away. Because when I sold my practice to an accountable care organization, my nurse practitioner still worked there. And when I spoke to her, and my grandma all of a sudden, she had dementia, but started acting really strange. I said probably UTI. Maybe it's the sodium level. Maybe it's a new medication, right? Let's check that out first before we say it's just the dementia. So she agreed, she put in the order, but the order was canceled. Because higher ups had a qualification criteria. And my grandma ended up septic in the ICU. Sepsis means blood infection, right? In the ICU. And I took her home on hospice and she lived another 4 months after that. But her lungs were ruined after that because it went all over. She had a pneumonia. So, lesson of the day for you guys, again, takeaway messages, right? Because otherwise someone comes here, they speak, you just listen and you're bored and you leave, you don't take anything away, right? Takeaway message, if something is off and it's new, look into it. Better safe than sorry. And advocate to doctors, right? And then say if something happens, I don't know what kind of conversation we'll have. And then believe me, there'll be a very different approach, right?
If you enjoyed this video and got value out of it, there's a new Medicare program called the Guide Model. It's completely new and it helps caregivers like you get resources like 24/7 support line. Have someone in your home help out with mom while you're taking a break. If you want to learn about it, there's zero cost to it. Look at the website right over here and apply to see if you qualify.